That strange heavy feeling in your forehead, the headaches in the first few days, or even the fear of a droopy eyelid, if you're getting Botox, these questions have probably crossed your mind. Here's the good news. Almost all of these side effects are preventable or manageable. Today, as a doctor, I will break down every potential side effects one by one, and more importantly, I'll tell you exactly how you can prevent them from happening. If you want to get Botox with total peace of mind, watch this guide to the end. Hello everyone and welcome back. I'm Dr. Jamalvandi. On this channel, we simplify the latest medical topics. If you want to stay informed, please consider following along. In our previous video, we covered everything about Botox itself, its amazing uses, and its strong safety profile. I'll leave a link to that video in the description and at the end of this video. But today, let's be realistic. Any medical procedure, even the safest one, can have side effects. Our goal today is not to scare you, but to empower you. We will name each potential side effects and immediately give you the prevention and management strategies, common and temporary local effects, and their solutions. Side effect 1. Bruising and swelling. What happens? These are the most common side effects. The needle, although fine, can nick a tiny capillary. Swelling is the tissue's natural response to the injection. How to prevent and manage? Before your appointment, for at least 1 week prior, avoid blood-thinning medications and supplements like aspirin, ibuprofen, naproxen, vitamin E, ginkgo biloba, and fish oil after consulting with your prescribing doctor, especially for heart medications. But I should note that it's not really important. If you get some bruising, it's not really important. It will be repaired. It will be go down. Immediately after, your injector will likely apply firm ice pressure. This constricts blood vessels and minimizes bruising. At home, for the first 24 hours, use a cold compress intermittently. For example, 10 minutes per hour. Avoid strenuous exercise and alcohol. Side effect 2. Headache. What happens? Some people experience a mild tension type headache in the first 24 to 48 hours, possibly due to the injection or the adjustment of muscle patterns. How to prevent and manage? Stay relaxed. Avoid stress activities right after your appointment. Safe medications. You can take a simple pain reliever like acetaminophen, Tylenol after getting the okay from your doctor. Avoid NSAIDs like ibuprofen as they can increase bruising. It's temporary. This side effect almost always resolve completely within the first week. Sensory changes and the heavy forehead feeling. Side effect 3. The heavy or frozen feeling. What happens? This is very common, especially for first-timers. You've been using your forehead and frown muscles your whole life. Now, Botox has temporarily relaxed them. The sudden absence of their movements can feel strange, heavy, or like there is a weight on your brow. This is not a complication. It's the desired effect feeling unfamiliar. How to prevent and manage? Mental reframing. Understand this is normal. It's like someone who wears glasses for the first time. It feels odd initially, but the brain adapts quickly. Start conservatively. A skilled injector can use a baby Botox approach for first-timers using lower doses to soften, not fully freeze, allowing for more natural adaptation. Give it time. Your brain will rewire its sensory perception, usually within 1 to 2 weeks. You'll forget the old feeling and get used to new, smoother one. Asymmetry and vision-related side effects. Side effect 4. Mild asymmetry or Spock eyebrow. What happens? One eyebrow may appear slightly higher if the Botox diffuses unevenly or if there was pre-existing asymmetry. How to prevent and manage? Choose an expert. An injector with profound knowledge of facial anatomy can assess your muscle strength and inject precisely to create balance. The 2-week rule. Do not panic. Wait the full 14 days for the Botox to take full effect. Often asymmetry resolves on its own as the produce settles. The touch-up. The reputable clinics almost always include a free follow-up appointment at 2 weeks for minor adjustments. This is your safety net. Side effect 5. Double vision or diplopia or droopy eyelid. Ptosis. What happens? This is rare but possible if the toxin diffuses into muscles around the eye that control eyelid elevation or eye movements. How to prevent and manage? This is crucial. Prevention is key. This risk is minimized to an extremely low level by seeing a qualified medical professional, a doctor, or a supremely experienced nurse under supervision, who knows the precise injection zone and depth to avoid. If ptosis, droopy eyelid, occurs, it is almost always temporary, lasting only as long as the Botox effects, 3 or to 4 months. Do not massage the area aggressively as it can spread the product further. Your doctor may recommend aproclonidine or lopidine eye drops. These can stimulate different muscles to lift the eyelid slightly, providing cosmetic relief until the Botox wears off. These require a prescription. If double vision occurs, contact your injector immediately. This requires some medical evaluation, but you should know that it's not dangerous too, but I know it's bothered you. The treatment timeline patience is everything. Onset of effect. It varies. Some see movements reduction in 2 to 3 days. Others may take 5 to 5 days. The golden rule. Full effect takes 14 days. Your result on day 7 is not your final result. The molecules need time to bind fully. Why the 2-week follow-up? This is the only time a proper assessment and any necessarily tiny touch-up injections can be made. You might look different on day 12 versus day 14. Always wait the full 14 days before judging the result or deciding on a correction. The Botox resistance wild card. What it is? In extremely rare cases, less than 1%, the body can develop antibodies that neutralize the toxin, making future treatments less effective. How to minimize the risk? A pro tip. Use the lowest effective dose. Space your treatments appropriately. While you can get treated every 3 to 4 months, the ideal maintenance schedule to reduce immune stimulation is every 6 months. This is a key long-term strategy for efficacy. Your 24 to 48 hours do not list critical aftercare. To consolidate all prevention, here's your immediate action plan. Do not rub, massage, or apply pressure to the treated areas for at least 4 hours, ideally 24 hours. This prevents diffusion. Do not engage the intense exercise, hot yoga, or saunas for 24 hours. Increased blood flow can spread the product. Do not lie flat or bend over for 4 hours after treatment. Stay upright. Do not wear tight hats or headbands. Do use the muscles gently and normally. Some practitioners recommend subtle exercising of the treated muscles, like throwing gently in the first hour to help uptake. Let's summarize the key to avoiding side effects. Choose wisely. Your injector's skill is 95% of your safety. Prepare your body. Avoid blood thinners before with doctor's consent. Ice immediately. Reduce bruising and swelling. Hands off. Don't rub the area. Stay upright and cool for the first 4 to 6 hours. Be patient. Wait the full 14 days for the final result and any touch-ups. Communicate. Attend your follow-up and tell your doctor everything. When these steps are followed, Botox remains one of the safest, most predictable procedures in aesthetic medicines. If this detailed guide gave you the confidence you were looking for, please give this video a thumb up. It helps us tremendously. Don't forget to subscribe for more science-based nonsense medical guides. To understand the full picture, watch our first video on what Botox really is and its incredible uses. The links is here on the screen, at the end of the video, and in description. Now I'd love to hear from you. which of these side effects were you most concerned about? Let me know in the comments below. Thank you for watching, stay informed and stay safe.